Our mob has been on this country for more than 60,000 years, and we have much to teach everyone about the land, care for our environment, the plants, the animals. Our culture is rich in connection, our family ties are strong, our traditional practice and lifestyle provide good health and holistic well-being of Aboriginal people. But now we're dying too young, our mob is sick and suffering from so many preventable diseases, and that's not okay. There are many strengths of remote Aboriginal communities. Our connection to country, our spiritual and ancestral heritage are strong. Our family ties and care across generations connect our communities and is the strength of our culture. Our traditional practice and lifestyle provided good health and holistic well-being of Aboriginal people. But there are factors which work against us and have a negative impact on our ability to thrive like other Australians. A history of discrimination and racism, grief and loss of country and of people, economic and social disadvantage, child removal and stolen wages, issues of violence and substance abuse, lack of reconciliation and treaty. All of these things mean that Aboriginal and Torres Strait Islander people are not that equal with other Australians, and that's not okay.
SOS Health Foundation exists to help close the gap in Indigenous health. We send volunteer physios, occupational therapists, podiatrists and other allied health professionals to remote Indigenous communities where access to healthcare is difficult. We also operate a permanent physio clinic on Palm Island, off the coast of Townsville in Queensland, serving the 4,000 strong, 95% Indigenous community.
May is Work for Significance Month all across the Back in Motion practices in Australia. Back in Motion has always been a key partner for the SOS Health Foundation, and we are part of the fundraising and the volunteer support, especially to raise money and skilled workforce for the permanent practice we run on Palm Island. Will you join us by getting involved in the fundraising activities at your local practice? In May, we want you to be part of the fun and the action. Across the month of May, the practices are aiming to raise $2,500 through all of these different activities. Your physios and the practice staff, they are working for significance on all of these days in May. And in some cases, they're even contributing a portion of their income to the SOS Health cause. And there's lots of ways that you can participate. You can win prizes, you can donate, you can be part of this great initiative.
Who'd have thought improving your own health through working with your Back in Motion practitioner could also make you part of improving the health of Indigenous Australians? Thank you, Back in Motion staff, clients and community for getting involved in Work for Significance this May.